Cystic lesions of the pancreas are increasingly detected by primary care providers and other physicians on a variety of radiologic images. Unlike cysts that may be found in other organs such as the liver or the kidney, pancreatic cysts should be better identified and worked up to look for malignant potential for the development of cancer. Many of these cysts require long-term surveillance with labs and imaging. Occasionally, these cysts may develop into or contain a cancer. There are a large variety of types of pancreatic cysts requiring expertise to determine the type of cyst which a patient has and the appropriate care plan for each individual patient. In order to better understand the nature of your pancreatic cysts, you may be referred to a specialty clinic such as our Pancreatic Cyst Clinic for further workup. The majority of these pancreatic cysts have a very low potential of developing malignancy or cancer and may just need to be monitored. Other patients may have a higher risk or have developed cancer and require treatment. The Pancreatic Cyst Clinic at Parkview Cancer Institute has highly specialized physicians who can evaluate your pancreatic abnormality and use their expertise to determine which type of pancreatic cyst you have and how to best tailor your surveillance or treatment to reduce your downstream risk of developing cancer while limiting the need for invasive surgeries unless they are absolutely required. In order to better understand what type of cyst a patient has, a highly specialized physician within the Pancreatic Cyst Clinic will review a variety of labs, radiographic images, and perform an endoscopic ultrasound, a procedure also known as an EUS. During this procedure, a high-resolution images are obtained of the pancreas through the endoscope and better identify and characterize the pancreatic cyst along with its relationship to pancreatic ducts. Also at that time, if the pancreatic cyst is large enough, fluid may be aspirated and further imaging with a microscope placed into the cyst can be done for analysis. We describe endoscopic ultrasound with fine needle aspiration of a pancreatic cyst in this next video. Your physician may ask that you undergo this procedure as part of a workup and better characterization of your pancreatic cyst.
Endoscopic ultrasound with fine needle aspiration is a procedure where a doctor uses a specialized ultrasound endoscope to aid in the biopsy of a cystic mass in the pancreas. In this example, the mass is in the head of the pancreas. These masses can occur in a variety of shapes and sizes throughout the pancreas. First, the ultrasound endoscope is moved into position within the duodenum, the first part of the small intestine. The tip of the ultrasound endoscope contains the ultrasound probe. Endoscopic ultrasound, or EUS, uses sound waves to make detailed images of features adjacent to the duodenum. In this case, the location and other specific features of the cystic mass can be identified. These features are key to the establishment of a diagnosis, since the cystic mass can be one of a variety of benign, precancerous, or cancerous types of lesions. Experienced, fellowship-trained endoscopists are able to evaluate the images leading to a diagnosis. Once the doctor knows that the endoscope is in the correct position, ultrasound helps visualize and guide the biopsy needle as it is pushed through the duodenal wall and into the cystic mass. Fluid within the cyst is aspirated or removed. The fluid is sent for analysis in the lab. If there are solid components, these can be biopsied and sent for pathologic analysis to determine its disease characteristics. The fluid and pathologic analysis are used in combination with interpretation of the EUS images by the endoscopist. These methods provide clues for the diagnosis of the type of pancreatic cyst and also help to determine how to follow or treat the cystic mass. In our Pancreatic Cyst Clinic, our highly trained expert interventional endoscopists use the details of the EUS, the labs, and the fluid analysis to personalize the patient's surveillance or continued careful observation and possible treatment. Most cystic masses can be followed with careful surveillance. Our advanced interventional endoscopy and endoscopic oncology program has a sophisticated database to track and follow patients with pancreatic cysts, along with performing research which may be confidentially shared with top university centers, ensuring the patient is receiving cutting-edge personalized care.